The overarching goal of our project is to improve scientific productivity in Central Asia and in the developing world. Central Asia is a region consisting of the former Soviet Union republics of Kazakhstan, Uzbekistan, Kyrgyzstan, Turkmenistan, and Tajikistan. As in most other former Soviet countries, much of the research results of scientists from Central Asia were published mainly in periodicals in Russian and mostly unknown to foreign readers. Hence, the scientific research from these countries is underrepresented in international literature. Central Asia is a region that has many emerging and re-emerging public health challenges, such as drug-resistant TB.
Since the fall of the former Soviet Union, health systems in Central Asia have been stretched to breaking point. Surveillance and treatment programs have been abandoned. In Kyrgyzstan, rates of tuberculosis, a highly infectious and deadly disease of the lungs, are at record levels. It's at its worst in prisons. Rates are 30 times higher than outside the prison gates.
In order to improve public health in Central Asia and around the world, we need to know more about biomedical research that is being conducted in Central Asia. Unfortunately, there is low level of English language biomedical publications coming out from Central Asia, and we don't know enough about research productivity in the region.
If knowledge access is important for development, how come so much of knowledge is inaccessible?
Our group of collaborators around the world decided to do something to change the situation and improve scientific productivity in Central Asia and in the developing countries around the world. We decided to establish the Central Asian Journal of Global Health, online journal designed to empower scientific productivity in Central Asia. Nazarbayev University in Astana, Kazakhstan is one of the key collaborators in this project and one of the key funding agencies that was able to support our activities. The Central Asian Journal of Global Health aims to create a forum for publishing scientific work where established researchers can share their knowledge on cutting-edge questions, as well as foster supportive environment for new investigators and those who have never published in an English language journal. This is the front page of the Central Asian Journal of Global Health. 3 issues of the journal have been published since 2012. Our network of scientists in Central Asia and around the world has close to 2,000 members. We want to welcome everybody to join us. The University of Pittsburgh is providing free open access platform for the establishment of open access Central Asian Journal of Global Health.
One big problem in Kazakhstan is that there is not much publications coming from Kazakhstan. If you will search for Kazakhstani authors or Kazakhstani publications, you will not find too many. As a matter of fact, for the last 16 years, only 5,000 articles were published from Kazakhstan. In comparison, US has published more than 7 million articles, China published more than 2 million, and Russia published more than 500 articles in internationally recognized journals. So what is the problem? We have a lot of smart people, we have a lot of science going on, but we don't publish. So what is the reason? So what we do in our research, we have applied different methods to find out why this situation is happening in Kazakhstan. So to solve this problem, there can be 2 approaches applied. The first is to research the productivity itself. And the second one is to help scientists to publish. And on our second aim, we have developed and currently working on Central Asian Journal of Global Health. The journal is aimed particularly for Central Asia and Kazakhstan. It's peer-reviewed, open access and mentored journal which specifically helps authors with their problems. For example, it could be bad English or bad methodology, but they can have a great data. And by helping them, we can produce a very good quality research.
In rapidly changing research environment, it is very crucial to share knowledge and obtain new knowledge constantly. However, it's not something that developing countries, including Kazakhstan, can be proud of. There are various reasons for it. For instance, limited English language proficiency, most universities and research centers not being able to subscribe to scientific journals due to its high cost, limited statistical skills of the researchers, as well as other systemic problems. So here is where Central Asian Journal of Global Health can play important role in raising publishing capacity in the region. Since Kazakhstan educational system, including postgraduate training, has shifted from old Soviet to the Western three-step system, we can notice a lot of changes, improvements in the country's research field that encourage people to publish.
Our collaborators include scientists from Kazakhstan, Uzbekistan, Turkmenistan, USA, United Kingdom, and many other countries. Welcome to our group.